Arrival on the scene, how to treat a stab wound. Now, as the blade enters the body, it tears apart the tissue structure, so you need to be ready for a huge amount of blood. Even a small knife in the leg or the arm is likely to sever a major artery. The victim's going to lose almost half their body's blood within the first half an hour. For every minute after that they go without treatment, the chances of death go up by 10%. So treat wounds to the legs and the arms as seriously as those to the body or the head. You should be familiar with the following common tissues on this stab wound. You can see yellow fatty tissue, brown here is muscle, in the centre, bone. Think about infection. The blade may look clean, but it's usually coated with bacteria. The knife injects this bacteria deep into the body of the victim, causing a virulent infection. Here you can see the effects of gas gangrene on a body that's gone untreated. This was the morning after the victim appeared to be recovering from a stab wound to the leg. Now, the best case scenario here is that he'll lose his leg to amputation. But if the infection spreads to the rest of the body, the most likely outcome is death. A knife in the chest is usually held fast by the bone and the surrounding muscle structure. If the knife is still in the victim, then don't take it out. The wound may be bleeding freely. If the blood is squirting out, then apply pressure till it stops. You can do this by squeezing together the edges of the wound alongside the knife blade. Try to get the victim in a sitting, upright position. This will stop the knife being jolted or knocked out. Now, in many cases, the victim's going to try to remove the knife themselves. Don't allow this to happen. The knife can cause just as much damage on the way out as it did on the way in. So keep the blade in situ, securely, and get the patient to the operating theatre. A stab wound to the abdomen the size of your thumb can expose anything up to 6 meters of intestines. Now, when these become exposed to the air, they may dry out, in which case they'll need to be cut away. An injury to the lower left bowel like this, for example, could necessitate the surgical removal of a large amount of intestine and the permanent use of a colostomy bag. If the victim is coughing up blood or vomiting, then hold their intestines for them to prevent more intestines coming out.